What is the peace and the love principle or the peace and the love protocol? This protocol was proposed in 2019. Following a soft tissue injury, for example in a hamstring pull or hamstring tear or ankle sprain, the immediate approach followed is peace. So P stands for protection, E for elevation, A for avoid anti-inflammatory modalities, C for compression, and E for education. So first let's talk about protection. Under protection, you need to restrict the movements for at least about 1 to 3 days. Why? To reduce the bleeding and also to prevent any further injury. Secondly, protection is done by minimizing the rest. Why? Because prolonged rest can compromise the tissue strength and the quality. Next, we have E. So E for elevation. Under elevation, elevating the injured limb above or higher the level of the heart is important. Why? To allow the interstitial fluid to move out of the injured tissue. Next we have A. A stands for avoiding anti-inflammatory modalities. So under this, the first one is avoid anti-inflammatory drugs because it impairs the normal healing process. Secondly, avoid the application of ice. Why? Because this might disrupt the inflammatory process and it delays the neutrophil and the macrophage infiltration. It also increases the immature myofibers. However, ice can be used to relieve pain, that is analgesia. Next, after A, we have C, which is compression or compress. So compression can be done, that is mechanical compression can be provided by taping or by bandaging, that is by applying a crepe bandage. Provided full range of motion at the joint should be allowed. Next we have E. E stands for education. Educating the patient that active approach is much better as compared to passive approach is very important during the recovery process. Although passive approaches, for example electrotherapy, acupuncture, they have minimal effect on the pain and function, whereas active approaches on the other hand improve the communication between the brain and the body for increasing the movements. Now, after the first days have passed, next we follow the love protocol. So L stands for load, O for optimism, V for vascularization, and E for exercises. Under L, which is load, optimal loading or weight bearing is very important. For example, by using crutches or braces. Why? Because it stimulates the healing process. Next we have O, which is optimism. Encourage optimism and stay realistic. That is, set realistic goals and avoid any barriers, for example fear and depression. Next we have vascularization. So under vascularization, early mobilization and aerobic exercises improves the vascularization, that is, it increases the blood flow. Exercises, for example the ankle toe pumping exercises can be done. Now why is this done? To increase the blood flow to the injured tissues. And then lastly we have E, which stands for exercises. Benefits of exercises includes it restores mobility, restores the strength, restores proprioception early after an injury.